All right, next up, what we want to do is we want to cover the blood supply to our brain. Somewhat important, all right, to cover these vessels. So what we're going to start with right here, all right, I want to kind of give you the name of this, all right? This is our blood flow or circulation to our brain, as well as the drainage. So the arteries supply, arterial supply of oxygenated blood is referred to as the circle of Willis. Okay, because Dr. Willis is the one that actually came up with this. And what you're going to see in here as we label these there are several anastomoses, okay, bypass systems that we have so that if we lose blood flow to one part of the brain, the entire brain does not lose blood flow totally, okay? So we're going to start up here. This is the anterior portion of the brain, obviously. It's going to be posterior back here, just so you know that. Okay, and we're going to draw these vessels out, and we're going to start naming these vessels. So I'm going to start right here in the center. We're going to talk about our two main blood supplies to the brain. So let's kind of actually move backward a little bit. Let me enlarge just a tiny bit here. So these two vessels here bringing blood to the brain, okay, are our vertebral arteries. Okay, so these are all arteries that we're drawing out up here on the circle of Willis. So those are our vertebral arteries right there. The other main blood supply to the brain, okay, are going to be these vessels right here, right and left sides. And these are our internal, INT, carotid, if you remember that. So remember when we did our artery slides, okay, our picture of our arteries, our two main blood supplies to the brain, vertebral arteries and internal carotid arteries, okay? So the vertebral arteries are going to join together, and they're going to come right down the base of the brain, right here. And this artery is referred to as the basilar artery. Okay, so that's the basilar artery running right down the base there. And then from there, we're going to have some branches that come back this way, okay? And they're going to branch off, and they're going to go all the way around. And there's several different branches coming off of these. You don't have to color these all in. But these branches coming off on the back portion right here, okay? These are the posterior, so we'll abbreviate posterior cerebral arteries right there. Posterior cerebral arteries. And then we have to have a circle formed or a bypass system formed. So these vessels on the back side here are going to be our posterior communicating. Posterior communicating arteries right there. Posterior communicating arteries. From there, these are going to come up and branch out, and you see several branches as they go up here. We won't color them all in again. These are our middle. Spell middle, correct, all right. Cerebral arteries right there. Some middle cerebrals coming off on this side over here, okay. Then as we come forward, we're going to have to be able to complete our circle and connect these two right here. So the connection that's made up in the front here is known as the anterior communicating artery. Okay, and then all we have left are the branches that come out front, okay, which are going to be our anterior cerebral. So when you first glance at this, it looks like, that could be a little bit difficult to kind of figure that out. But when you kind of put it in a different perspective, once you know the two main blood supplies to the brain, which are the vertebral and the internal carotid, from there, all you have is the basilar, which runs down the base, okay? You have posterior, middle, and anterior cerebral arteries, and then you have the posterior communicating and the anterior communicating that connects it to help form this circle, which we refer to as the circle of Willis again, okay? Now, as far as drainage of the blood from the brain, okay, what we're looking at down here, these are going to be the veins. So as you'll see in your notes there, it says veins right there. And if you remember from our clear brain model, you have the superior sagittal sinus right in the midline here. You have the inferior sagittal sinus underneath that, okay? Straight sinus is behind that. I'm not going to ask that you know the straight sinus for me, okay? But if you see this picture, know that. Also, with cavernous sinuses, we don't have them on the model, so we can cross that out. But on this picture, I might ask you superior sagittal sinus, inferior sagittal sinus. We have the transverse sinus, which you can see on the clear model. So make sure when you look in the atlas, you identify where that's at. And you'll see where it makes this little S-shaped curve here. That's known as the sigmoid sinus right there. Okay, and that leads to the jugular vein, internal jugular vein, which is going to drain blood from the brain, all right, and the sinuses, all right. So that is blood supply to the brain and the drainage of blood from the brain.